again, this is Rimon from Toronto, right now with one of my very special guests. And I would like to say a few words about my guest before I introduce him to all of you. So he's a young guy, currently residing in Toronto. He was almost brought up whole his life in Toronto. Both Hamilton and Toronto is close to him. He went to McMaster University to complete his BSc, and his focus there was neuroscience. At the same time, after completing his McMaster University degree, he went to University of Toronto, which is very well known, and some call it Harvard of Canada. At U of T, he completed his MD and PhD, and right now in neuroscience in the same subject. Now, as he discusses the science behind human mind and brain, I would like to ask him something around this time, COVID-19, which is impacting us completely differently. World had no idea that it's going to face this situation like the way we are facing. And here is a doctor. I would like to pick his brain. What's going on? What's the future? What it looks like? What we should do? Should we be afraid? And since I'm talking with somebody who deals with brain and mind, I would like to know how it is impacting us psychologically. This is a doctor's take and not Rimon. So welcome, Dr. Ayan Dey. How are you? How are you?
Yeah, I'm doing very well. So just to clarify, I'm a recent graduate of the MD PhD program at U of T, and I'll be starting my residency this coming July in Toronto as well. So I'm not currently working on the front lines, but playing more of a supportive role and this COVID crisis at this time. That said, I'm a part of many of the online physician groups that are discussing what's being done about COVID and what's being done in the hospitals. Also, many of my friends and colleagues are working on the front line, so I hear from them about what the situation is. They're working at the hospitals, they're working at the ICUs, they're working at the assessment centers. So far, things are still manageable at the hospitals, but the biggest concerns right now are one, running out of protective masks, and two, running out of space in the ICU.
So we'll go into that, Ayan. But before that, I would like to backtrack a little bit just to get to know you, right? Okay, because I'm sure that those who are listening to this, and even the future generation, they will listen to this with looking for inspiration. So if I may ask you a different question, completely and off guard, I didn't discuss this. What made you pursue this profession?
So as you mentioned, although I was born in Bangladesh, I came to Canada when I was very young. So I came to Canada when I was 1 year old. I grew up in Hamilton and went to McMaster to study neuroscience because I was really interested in studying the mind and the brain because there was so much of it that we did not know.
We didn't know.
And then I became really passionate about doing research and learning more about the world and how the mind works. And that's why I decided to do a PhD as well in neuroscience. But at the same time, I was interested in working with patients and in diseases of the brain. And that's why I did medical school.
Perfect. So now we know that you are into it, and especially study of the mind is a fascinating subject, I personally believe, right? Because mind is something which is intangible and we don't know, right? Okay. So trying to understand that is a complicated matter, and you are in that field. So let me get back to our topic today, which is basically I wanted to know about this COVID-19, the way it is impacting us. You are connected to the doctors community. You are connected to the medical profession as a whole. At the same time, I do see through different interactions, you are taking very keen interest in educating public, what we should inform, what we shouldn't, and things like that. COVID-19, if I have to ask your overall assessment, how it has impacted us suddenly, out of nowhere, nobody was ready. Right? From being within doctors' medical profession, how do you see it? What's your take on that?
Yeah, so initially, Toronto and much of Canada felt that we were very prepared at the beginning because Canada had handled the SARS crisis over a decade ago very well. So initially, we thought this was going to be much like SARS, but at the moment, COVID-19 is actually far more contagious than SARS. So it was initially underestimated, and now the new reality is being accepted, and the hospitals are quickly working to prepare for what is to come. we are expecting things to get much worse before they get better, and this to last at least a few more months before we hit the peak. And the government, we're working very closely with government to try to get enough masks and develop enough space to handle the influx of patients.
All right. So what I hear, and I wouldn't say it's worrisome. Maybe we all know about it, but if I may, just bring it out, just because it's out everywhere, right? Okay, we are discussing, and you'll get to know. So what I hear is that we are not at the peak yet, and
No.
we expect the situation to be going little worse than right now it is. Am I right?
Yes.
And what tells you that?
So we are all getting guidance from the public health officials who are working with data scientists or epidemiologists who study diseases and how diseases spread. So we're expecting the number of cases to increase, especially because we're doing more testing now. Up until recently, we didn't have that many assessment centers. We didn't have enough tests. You may have seen on the news that Ontario was only testing about 3,000 people
3,000, which they're bumping up to 13,000 right now.
Exactly. So as we test more and more people, we will find more positive cases. The good news is the vast majority of these cases are mild, so they don't need to go to the hospital. They just need to stay at home.
Good.
And they will get better on their own.
And what I hear is that even though we are getting these numbers, 20,000, 30,000, whatsoever is the number could be more than that, but because we haven't tested everybody, we don't know. But as we test, we will be able to identify, okay, here is one, here is another one, so the number is likely to go up, right? Okay?
Yeah.
Okay.
And,
go ahead.
And that's why we're asking everyone to just be safe and stay at home, because the numbers are likely much higher than we see. Like the true numbers are much higher, but it's not a reason to panic, because majority of people are mild, as in they do not get very sick. They may get COVID, but they don't get sick. But about 5% of people do get very sick, and we want to protect those individuals. And these are people with heart conditions, with lung conditions, or people who are elderly.
Okay, so question to you, just being with medical profession, being a doctor, what do you see? What is COVID-19 sickness is all about? I'm a simple layman. So what is this sickness like? Is it very serious? Is it okay to be afraid but yet not be extremely, or is there a hope? Is it something that if I catch COVID, I'm done? How do you see it? Like your take?
The way we see it is, COVID should be taken very seriously. It is majority of people will be fine.
So that's a good news. Okay.
Yeah, majority of people will be fine. It's only the minority of people. But because COVID is so contagious, the minority is still a lot of people, and that's why we want to ensure, like, even one person dying is a big deal, right?
Big deal. Like,
so
even
when we hear estimates of 10,000, 20,000, 30,000 people dying, that's very scary, right? So that's why we're taking it very seriously, because we want to prevent deaths as much as possible, even if some will be inevitable, because it's how quickly the virus is spreading. But majority of people will be safe, and they'll be able to get through this without much harm.
And it does impact your lungs. So that is the most a main thing, like where it does affect your respiratory system.
It's affecting the respiratory system. We are learning more and more about the virus every day. So the information is constantly changing. So I'm going to withhold from describing what the virus is, because that is changing every day. And doctors are learning more and more about how to treat this. So initially, it was thought to be a respiratory disease, and it still is, but there's current discussion it could be whether it's a blood disorder or a hematological disorder. So that is still being researched, and we're trying to understand what is actually going on.
I respect that. Like, we are not definitive. That's the whole point,
there's
right?
Nothing that's definitively known, and there's a lot of research going on throughout the world, and everyone's trying to work together to come up with a solution.
Okay. Ayan, even though right now you'll go back to frontline, you're behind the support system, but I'm sure you know about what the medical profession is going through. And before I talk about the client side, patient side, or the general public, I want to know about the doctors and nurses. How do you feel? How they're coping up? Because to me, it appears you are telling us, the medical profession is telling us to you that, hey, maintain social distance. Hey,
Mhm.
lock yourself up, or means isolate yourself in your house. But
Mhm.
again, medical profession, we see you are defying that rule. What you're doing is you are going and taking care of that patient. You are going and holding hands, even though there is PPE, personal protective equipment, still is a risk. What is the risk to the medical professions that you see? What is the chatter is all about within the profession? How how it is impacting life of the doctors or the
Yeah.
nurses? I want to hear your take.
Yeah. So I have extreme respect for all the healthcare workers working on the front lines right now, as they are at significant risk of acquiring COVID. Uh, they are making significant sacrifices to not get their families sick as well. I know. I'm hearing stories from some of my friends who are working on the units. So I know one resident who has not held his newborn baby yet, who was born about a month ago because he's working in the ICU. He doesn't want to get his wife and baby sick. So he hasn't seen his baby yet, even though it was born like a month ago. I know another emergency physician who's like about 55, and his wife asked him to quit because they don't really need the money, just to go to the cottage and be safe. But he continues to work in the emergency room. And
Wow.
then when he comes home, he goes to the basement. He hasn't seen his wife or his child. Like he's avoiding seeing them, just so he can continue to work and help people. Healthcare professionals are definitely making a lot of sacrifices, and in turn, they're just asking for access to protective equipment from the government, and also so they can do their job, and asking the public to stay at home. At this time, there's about 10% of positive cases in Ontario are actually healthcare workers. In Toronto alone, there's about 31 healthcare workers that are infected, 12 of which are doctors and 13 are nurses, and that number is expected to rise.
Wow. Wow. I am literally speechless. I am literally speechless. And uh, I have goosebumps all my body. A doctor, he hasn't seen his firstborn baby or a newborn
He's
baby
at home.
yet.
He's seen the baby on like
He's seen, but he
video.
didn't go, right? No physical
Yeah.
interaction. You didn't give that first hug, right?
Hmm.
Okay, or this 55, he could retire, he has money, but he chose to be in it, embrace
Hmm.
the risk and rather serve. And I know I just don't want to leave out other professions, those who are working, for example, the grocery stores. Every single day you're interacting, you are exposed to risk. I don't want to leave out the frontline bankers, those who are in the
Hmm.
branch. You have to work and you're interacting with the people. I don't want to leave out the car salespeople that have to, work with the people, or the janitors, for example, or the TTC bus riders. Everybody is making sacrifice. But that while you talk about our medical profession, they are at the front, just leading us, right? And most exposed. I say that very consciously. Most exposed, no doubt, to this risk, where they are embracing it in order to save us, the humanity as a whole, right? So, Ayan, please convey my and all of us our gratitude, our thanks. What can we say more to all your friends, those who are making this sacrifice? Just in a segue to that question is about the families of the doctor, not the
Hmm.
doctors themselves or the nurses themselves, but every day they are exposed to this risk and they come back home or they don't. How is the family
Yeah.
protecting?
So it depends on what the situation is and who they're living with. Some physicians are, for example, renting hotel rooms and they're staying in the hotel room. Some are staying in a separate section of their house, like the basement or another side of the house, so that they don't
Ah,
get their family sick. It really depends on what the situation is, right, and what the risk factors are. Some of them are coming back to their homes, but they ask their partners to go to their parents' house or somewhere else to live while they are still working here. So this could go on for a few months, right? But it's one of those necessary sacrifices that people are making in order for the greater good.
I am speechless. I am speechless, as I'm glad that these stories are coming out and I could be as well part of it. That is my job, trying to bring out these stories that touches our life. And the sacrifices that everybody is making. Ayan,
Mhm.
while the doctors or medical profession is going on making this sacrifice and taking care of us, what can we public, the citizens of Canada, do to make it easy?
Yeah. So the simplest measure to keep safe is to just stay at home and avoid unnecessary trips outside, unless you're an essential worker. So you're working in the grocery stores and etc. Avoid visiting any friends or families. Personally, I haven't seen my own parents in over a month in order to keep them safe, even though I have no symptoms and I've not been out and about. I'm just trying to take all precautions. If going outside, the government is now recommending that people wear cotton masks that they can be easily washed after use. So we're also asking everyone to wash their hands more frequently with soap and warm water. And if a sink isn't available, hand sanitizer is okay, but it has to have at least 60% alcohol. What's also important to keep in mind is when bringing home groceries from outside or things from outside, have an area of your house that you sanitize the materials before putting them away. So if you are bringing home, like say, cereal boxes or etc., maybe you take a Lysol wipe or something that's similar to a Lysol wipe and like clean it off before storing it away. That way, you're killing any bacteria or viruses that could be on it. It's also important to keep on top of your mental health as well.
So everybody, I was talking about the medical profession, what risks they take on every day in and out, and what are the types of exposure they have and how they are managing it. So let me ask Ayan right now, what can we, the simple citizens, simple people, day to day, every day, we can do to actually make it easy for not only us but for overall the community that includes our healthcare professionals, right? So Ayan, what can we do actually as a citizen to make it easy to face
Yeah.
this COVID-19? What is our responsibility? What should we do? What would be your advice?
Yeah, so you've heard from Trudeau and the government and everywhere on the news. The goal right now of these lockdown measures is to something called flatten the curve,
Right.
right? And that means we do not want everyone to get sick all at once because that will overwhelm the healthcare system. And the best way to do that right now is to just simply stay at home and avoid unnecessary trips outside unless you're an essential worker. And so that could be in the grocery store, the bank, or whatever those essential jobs are. That means avoiding visiting any friends or families. Personally, I haven't seen my parents in over a month, just in order to keep them safe. If going outside, the government is now recommending that people wear cotton masks that can be easily washed after use. Wash your hands with soap and warm water, and if the sink isn't available, use hand sanitizer with at least 60% alcohol. So you should check the label to see that has 60% alcohol if you're using hand sanitizer. Now, when bringing groceries home from outside, we recommend that you have like an area of the house that you put down all those things, and then you sanitize those materials using Lysol or Clorox or something like that, just to make sure that there's no viruses on those materials before you put them away. To keep on top of your mental health as well, because we may be in this for quite some time. So it is okay to go for brief walks outside, so long as you keep a safe distance to other people. It's also important to get some physical activity even at home. And there's a lot of online videos that show exercises that you can do at home. One good exercise could be yoga, which is good for the mind and the body. Also, with respect to mental health, it's important to find ways to keep yourself stimulated at home. As this is particularly important for people who are recently unemployed. So don't try to spend all day watching TV or watch the news. Start new hobbies, take online courses, learn to cook new dishes at home. All right, set small goals for yourself every day so you
Good.
can make them and get like a sense of accomplishment every day. Right, that way the days don't seem to all blend together. Also, keep in mind that social distancing does not mean that you cannot call or have video chats with friends and family. You can still keep in touch with your friends and family. It's just recommending that you don't go visit them unless they're living in your house. Um,
Okay, no, very good advice. Some of the things, these are new things actually, I'll tell you, even I'm learning, right? Setting goals every single day, trying to enjoy life within your within your limited periphery, what do you have? There are, technology actually gives us so much, and it has changed the way the world, and it will keep changing more. And Ayan talks about the mental health, which I would be delving into a little more later. But then mental health is extremely important because your perception matters. Health, physical mind, physical self, and mind self, mental. These two are very much interconnected, right? So taking care of that is extremely important. And what I understand is that grocery, that was a very good point brought out by Ayan, is that we need to sanitize them. We need to just to be safe and bring it in an area in your house which is isolated maybe, and you can sanitize using some sort of sanitizer that has at least 60% alcohol, right?
Yeah.
Okay, and another take I'd like to see, you are in social media, I do see you helping people, giving informations. And now before I talk about the misinformation, I want to give you a little perspective. And because you are an, I would say, expert, or you are a knowledgeable person in mental science, neuroscience, how brain and mind works together, so you would possibly agree with me, mind doesn't always follow logic, right? Fear has no logic, right? Okay, it's an emotion, right? And the general people, we are all susceptible to all sorts of emotion, fear, and especially social media also makes it very difficult for us. And the reason I say it, because nowadays every news is a news. You get some informations, no authenticity, no authority, no source, and yet all you need to do is share, and it goes viral, and the information goes out and out. Now, whoever is doing it from perspective of the public side, the thought is that I'm helping people. So in their mind, they're helping people. They just heard, hey, take a sip of coffee every morning in the, or gargle with hot water, right? Okay, and they want to help. But in the process, I do recognize that some misinformation gets traveled, and that could be dangerous at times. Here is what is your take on this misinformation, and how do we manage it? Because if we are very strong on it, in general, especially with the community groups that I see, is that then there is something called, okay, this is freedom of speech. These you are being very harsh. You are being, very difficult. Why don't you approve it, and things like that. So how do we handle this misinformation, and what is the extent of it? Let's talk about the extent of misinformation. What do you see?
Yeah, there's because we're also very connected now. We have so many different sources of information. Before, a lot of times people would only get their information from the newspaper, and that would be the only option. Now you can get information from your phone that just as easily. You can spend all day getting information from various sources. So sources of misinformation right now can be like WhatsApp messages that are just forwarded to you, Facebook, everyone just posting different articles, and even the news networks.
Yeah.
Even the news networks who are trying to get viewership, and everyone's bringing in different experts to talk about it, and sometimes that information comes from a good place, but may not be the most well informed, because information is constantly developing right now. We're learning more and more about the virus every day, so it's important to get that information from reliable sources.
Right. So technically, I said about the extent of misinformation, so we understand there is a lot, right? Okay.
There's a lot.
How do we deal with it?
Yeah. So it's important to be something called being critical of the things that we read, right? So do not believe everything you receive on WhatsApp or Facebook, or everything that you see on Facebook, or even what you see on television networks. You can't really believe it unless it's coming from a reliable source. So you need to stop and ask yourself, who is talking? What is their credentials, right? Where are they getting this information from? Is there any data to support this? Try to get your information from reliable sources, such as government websites and websites of universities and hospitals. There's a popular website among physicians called Uptodate that has lots of good information on COVID, and they've made this information free to the public. So if you just type in Uptodate and then put COVID-19, you'll be the first link that you see on Google right now. And that's a really good source of reliable information. That's up to date every day.
Up-to-date COVID-19.
Yeah, just type in Uptodate and then COVID-19, and it should be one of the first websites.
I'll put the link in the video itself so that you can go and check it out. Okay, so that's about, now, here is my personal dilemma, right? Okay, and take it with a grain of salt, please. And I'll ask very bluntly, I don't know. So sometimes we do get some informations which Even I myself, I read, okay, and then I find, well, if I share, there's nothing wrong in it. And I'll give you an example. So somebody is telling, hey, we don't know, but every day drink hot water, gurgle hot water, right? Gurgle with hot water. Get a cup of coffee in the morning and the evening. This helps. Now, whether this helps or not doesn't matter. But what I sensibly I think or I decide or conclude is that, well, there's nothing wrong in taking gurgle water or in taking hot water, a sip of water in the morning and evening or every after now and then. So perhaps I don't know whether it is effective or not, but let me share. How do you see that? And those are, again, I do follow, assume what you said, which is don't just forward it or share it without reading. So let's assume I read it, right? I'm just giving a hypothetical example, and the information, I have seen it in Facebook actually. Information says that do take hot water, do gargle, right? Okay, this may help. Now, I personally, I'm critical, and I'm looking at it. I'm saying that, well, there's nothing wrong in it. It may not benefit, but it will not harm. That's my common sense. And then I share with it. How do you see this?
Yeah. So I agree. There's no, like, in many of these articles, there may not be any harm necessarily, and may actually be things that are good for you in general. It may not help with COVID, but it's a good thing to do anyways. The important thing to keep in mind is that we do not want to give people a false sense of security.
Yes,
right?
yes, that is important.
That because they're doing all this, they can go out and not follow all those precautions. Just because they're gargling water, they can go to dawats and stuff. That's not going to protect them.
Yes,
right?
yes.
And another follow the recommendations.
Right. And another example of such, I'll tell, that is that generally it doesn't need to be authenticated, if I'm not wrong, which is build a strong immune system. So many things are telling, okay, go and take some banana or some food, some fruits and all these things. These are good informations, right? Just wanted to clarify that. Thank you so much. Now, we are almost at the fag end of this thing. Any idea how long it's going to go on or how long we are in it?
At this moment, no one knows the answer to this. According to models, we are not at the peak yet, and we should hit the peak somewhere between late spring and early fall. So that's a very big range.
Very big range.
That's because we just don't know. We can expect things to continue like this for at least another month or two before things start getting less strict. So we can expect this to go on for at least a month or two. Beyond that, we don't know, right? But what is probably true is that we do expect things to get much worse before they get better, but they will get better.
Okay. So here is something I want to add, so that, because I know that our informations, and I want to protect my guest as well as me, our informations are based on whatever sources, information available right at this time. So right tomorrow, there could be a miracle cure, and that says, hey, we got it, and the problem is over in just 2 months, 2 weeks. And then I don't want you to be seen that, you know what, oh, yeah, Ayan and Rimon, you guys discussed that it will continue into spring and all these things. How come? So basically, all of us, we are giving our best case scenario based on the information available right now. So the prediction or the projection, everything can change based on a new information which we do not know, right?
Yeah.
Okay.
Information is coming out every day. But right now, across the world, these measures are being implemented. We're expecting it to go a month or two. But yes, the information is changing every day.
Every single day. Last question. You deal with human mind. Very fascinating subject. People are afraid, a little anxious. And there are times that this anxiety doesn't come through. It doesn't manifest openly because people want to behave socially, oh no, I'm fine, and all these things. People are going through difficult situations. I'll just give you an example of even myself, right? I don't get to see my kids every single day, and because my daughter is sick right now, so we are a family of 4. We are divided into 3 places, right? So I go through this, and am I afraid of my child? Yes, I am. Am I afraid of myself? Of course, it affects, right? Okay, that if I catch cold, for example, or catch COVID, and I go and hand over the food, that can infect the kids, right? Okay. the reason I'm telling, so people has this thinking going on, mindset, mind, anxious. How do we deal with it? The mental aspect of it. I want you to highlight a little bit if you can.
Yeah, there's this article that I think I shared with BCCB not too long ago regarding this aspect, the mental health aspect, because it's only human nature when you're getting all this information about all the danger that we're in to feel anxious, right? I think that's a healthy amount of anxiety is okay, especially with everything going on. A reasonable person would be a little anxious. It's actually more dangerous to not be scared at all because that's when you make mistakes.
Okay, it's okay to be scared. Okay, it's
A
okay
little
to be,
bit, a
yeah,
little.
little bit. Yeah.
Yeah, it's okay to be cautious, right? And to be careful. That said, it's very important to keep our mental health, and that's why I made the element of the mental health. That's why I discussed the mental health aspect because we're stuck at home and reading all this news. It's important to keep in mind how all this is making us feel. The best way to sort of control that is to control how much information you're getting. Don't spend all day watching the news. Don't spend all day reading articles after articles about COVID and all that.
What's the movies?
Do something that you enjoy. That's nothing to do with COVID. Don't spend all day doing this, right? Do things that you enjoy. Read a book, right? Go exercise. Learn how to cook new dishes. All the things that I mentioned. Take on new hobbies, right? If you like, for example, you wanted to learn to play a musical instrument, right? This is a good time to learn a new musical instrument. There's so many things you could be doing that before you said you had no time. Now you suddenly some people have a lot more time, and this is a good opportunity to learn those new skills, right? And don't just get absorbed in getting more and more information and getting scared about this, right? Just be cautious, but don't be overly paranoid, right? Like that's what I'm trying to say. Like keep your mind off this topic, and
Okay.
while also being safe.
Dr. Ayan, thank you so much. It has been absolutely a pleasure talking to you, getting the mindset, knowing some of the things I had no idea. Uh, Not firsthand because it came through you, but then understanding it through someone who is very closely associated with the medical profession, dealing with doctors every single day, not being able to see his newborn, not being able to stay with the family, staying at hotel or somewhere else isolated. These are the stories that touch us, that also tells what a sacrifice we all are making. On behalf of everybody of us, and I would like to say thank you. Thank you so much for coming to my show, discussing this thing. And definitely, I will make every endeavor so that it reaches every single person, as many as we can. To everyone that have been watching, I think this is one of the phenomenal segment that I did with my guest. I have to tell it to you. I think this is one of the most impactful where I got to know the take about our life through the eyes of a doctor. And some of the advices that are given, including mental health, it is unbelievable in the sense that we haven't thought about it. We thought about this whole COVID crisis as something, something being afraid of, being scared of, anxious. But within that, we now know that we can use our time also to do something good. Okay, whatever you like, read a book. And just wanted to finish. Yes, I do recommend, and I'm reading actually a book as well. So this is about John Diefenbaker, if you know him. Do you know? Okay, so he is one of the prime minister. He's one of the prime minister of Canada. He was at 9 years old. He said that to his mom, I will be the Prime Minister of Canada. And he became the Prime Minister of Canada. He's a conservative, right? So as I talked about conservative, so that people do not brand me conservative, I am a branded Canadian. Okay. This is another book. And I read this book. This is a fantastic, phenomenal book, which says, just watch me. You can see, right? So this is written by Trudeau the senior, right? Okay, read books. That's what he said. Watch movies, cook, learn some new recipes, and so on and so forth. That's what I'm also trying to do. Thank you so much for watching. Thank you, and for your
pleasure.
time. Okay,
My
all
pleasure.
the best.
Thank you
To everyone. Thank you. Be with me. Let's walk the journey together. All the best. Bye bye.